Okay, this is a delayed meeting of the Subcommittee on Health Occupations and Long-Term Care. We have, I believe it is 7 bills before us. And we will begin with House Bill 774. Council, Lisa.
So this bill requires the Maryland Department of Health to investigate credible allegations of assisted living residents having been subjected to neglect, exploitation, or abuse when a person is found to be knowingly and willfully operating, maintaining, or owning an unlicensed assisted living program. If neglect, exploitation, or abuse is found, the person operating the unlicensed program must be subject to immediate prosecution. If MDH finds no reason to believe that residents have been subject to exploitation, neglect, or abuse, MDH must provide written notice to the unlicensed program requiring compliance with licensure requirements within 30 days. There are amendments that were distributed. The First Amendment is technical. The Second Amendment specifies that it will be the Office of Healthcare Quality who will investigate an allegation if the department does not. It adds exploitation to the allegations that will be investigated, and it specifies that all abuse and not just physical abuse will be investigated. And then Amendment 3 authorizes the department to adopt regulations.
Okay. So there is unanimity among the affected players, among the regulators with these amendments, both the AG and the county health officers and the health department. Is that correct?
I'm not sure that we've actually heard from the health department.
Okay, that's right. My notes only included county health officers and
yeah.
Okay.
All of those parties are okay.
Is there any debate? Yes, Delegate Riley.
Unmute myself. There
okay.
we go.
There you go.
Yes, could Lisa, so actually during the hearing, I had asked the AG, I think a question about, the licensing process. What would these homes have to do to actually get licensed and all the details? Because it was in the COMAR number was inside of the fiscal note. So I had the library just send that, but obviously we've been busy all day, so I haven't had a chance to read over it. So it's several pages long of different things that they have to do to comply, to get a license and so forth. So Lisa, can you give me a wrap up on what that entails, or?
Okay. I'm not familiar with the whole license.
Well, I would think before we would move forward as a committee, that, we took time to read over all of the, the rules and the requirements to actually, require for these folks to be licensed, especially if they've had just, 2 or 3 people in their home. We should know what they have to do going forward. Now, again, I believe this is definitely a serious issue, and I wouldn't want, my mother or my father or my husband or me, wind up in one of these homes that are, misusing the patients. But I'm not sure that it's, the degree of what the violations are and how many, this is happening to. I think, the blue collar person that, is not on Medicaid, and then they have a sick parent and they can't afford a nursing home. I mean, this is going to take out a large pool, I think, of people that can actually, send their mother or father to one of these, nice homes, I would hope. So I understand the purpose of the bill and the intention of it, but I just want to make sure that, we're not, throwing out the baby with the bathwater in here, and maybe, a good amendment would be to, increase the number, of beds that they have in the home. I don't know, but I think, I would like some more information on how many violations have been happening with this reduced amount of folks in the home, and then actually, take a look and see what these people then have to do.
So I don't know if there's anybody else on the call that can help you with exactly what the licensing process is, but I will say that there is a letter from the Department of Health that says that OHCQ has investigated about 120 allegations of unlicensed assisted living programs each year.
I'm sorry, you said 120?
Mhm.
Okay.
And does it say how many were found to be in violation? Or that's why we need the bill?
Well, they weren't licensed, so they weren't. It does not say necessarily about the abuse, but it.
Okay,
it
so
just-
they just weren't licensed, possibly no
Correct.
abuse, they just were not licensed.
Yes.
Okay.
Okay. Well, why don't we put this on hold? Because we're going to be meeting again. So we'll put this one on hold. Okay, thank you, Lisa.
Thank you, Madam Chair, or Mr. Chair.
That's fine, no problem. House Bill 456, pharmacies, prescription drugs. Lindsay,
This bill, as introduced, requires each pharmacy to notify customers that an accessible label for blind, visually impaired, or otherwise print disabled individuals is available on request for no additional cost. On request, a pharmacist must explain to the customer the available accessible label format options and provide the customer with their choice of accessible label, and the State Board of Pharmacy must adopt regulations to carry out the bill's requirements. I circulated an amendment from the sponsor that strikes the bill and instead requires the State Board of Pharmacy to adopt regulations necessary to ensure that individuals who are blind, visually impaired, or otherwise print disabled have appropriate access excuse me, to prescription labels, bag tags, and medical guides at no extra cost to the individual in a format option through which the information is fully accessible to the individual and within a time frame comparable to the time frame within which the information is provided to an individual who's not visually impaired. It requires the board to give visually impaired individuals an opportunity to provide input on the regulations and requires the regulations to conform best practices established by the U.S. Access Board and to follow certain guidelines and recommendations issued by the U.S. Government Accountability Office and include a method for providing notice to customers. The regulations must be adopted by January 1st, 2025. In honor before December 1st, 2023, MDH must submit a report on the potential process for and costs of implementing enhanced professional dispensing fees for providing accessible labels and compliant packaging to visually impaired individuals. Now, when I circulated this amendment, I let everyone know there is a technical change. The sponsor let me know they received the amendment very late before the subcommittee. Well, what we thought was going to be very late for the subcommittee. I suppose in hindsight, maybe we could have gotten it fixed. But so if you're looking at the amendment, if you have it in front of you, there's a C1 and 2, and then there's a D immediately below it. They would like that language in D where it says the regulations adopted under subsection A of this section may. Instead, they would like a shall, and for that to replace C1 where it says conform to the best practices established by the U.S. Access Board. So instead, C1 is gone. It would say the regulations adopted under subsection A of this section shall follow the guidelines and recommendations in the prescription drug labels. And then 2, include a method for providing notice to customers that accessible prescription labels. And as far as I understand it, the sponsor worked on these amendments with the Pharmacists Association, who's here, ALIC is here, and some other advocates, as well as Delegate Hill on this committee, but not on this subcommittee.
was it also worked out with the groups representing the visually impaired?
Yes, I mean, they're the ones who brought the bill to the sponsor in the first place.
So they're part of the agreement?
Yes.
Just to make sure. Okay, so everybody's on board among the affected parties.
I believe so. I'm not sure if MHA was involved or not. I saw Jane, I thought earlier. Yep, Jane is here. So I don't know if she could speak to that. I didn't see directly whether or not she was involved in this.
Okay. Delegate Morgan. Oh, your hand's down. Delegate Ms. Horton, excuse me. You're recognized.
Definitely not a delegate. You guys worked
Okay.
way harder than I want to. Yeah, so we did talk through a lot of this. We're generally fine with it. There was just one part that I would like to be amended. The part where we request, I just gotta switch over. At the very end of the amendment, I'm asking about the where is it? The professional dispensing fees, if it could just end after compliant packaging, so that we could have it address anyone that may have accessibility needs versus just focusing on the visually impaired. And so just like it to end with the period providing accessible labels and compliant packaging. under that section 3.
So
That
you
would
would strike
broaden-
to visually impaired individuals?
Yes, it's for implementing enhanced professional dispensing fees for providing accessible labels and compliant packaging, period.
Where is this? I'm sorry, I see.
So it's a new special section 3. It would be at the end of the amendment. It says that on or before December 1st,
okay.
2023, Department of Health shall submit. I do think, like, generally the bill is focusing on packaging for visually impaired people. So this report could then be potentially a lot broader. I'm not sure what other types of individuals you're thinking about, like
There are
someone
people
who
that
has
I was
like
just
arthritic issues. Like, I'm not sure exactly.
Yes, so I was thinking as we were talking about this and accessibility needs, and one of the things that we were trying to do was balance the need for pharmacies to address the accessibility needs of their patients, and they're broad. And I know this bill is largely focused on the visually impaired, but operationally, these accessible labels are expensive. Complying with this will be expensive for our pharmacies, and the committee knows about the challenges that our pharmacies have. So we're looking to find a way to balance that, and thought that this would be an opportunity to look at the broader perspective of providing equity and accessibility to patients and ensuring that pharmacies can do this without incurring additional costs. So right now they do provide compliant packaging. They're like blister packs and other things that make it easier for patients to access their medications. And yes, there's some with like dexterity issues and other.
Excuse me, would your language, do you intend to go beyond those who are visually impaired? Because
Well, what I would say is that our pharmacies in many cases are providing this. And it is more expensive.
print disabled.
I'm sorry.
I'm sorry for interrupting,
Uh-huh.
but the amendment number 1, the purpose clause language refers to individuals who are blind, visually impaired, or otherwise print disabled.
Mhm.
Would it be acceptable to change to have that section 3 end and compliant packaging for those who are visually disabled? I think that covers everybody.
If that's the intent, then the language that's there is fine. I was just looking at it. Since we're going to be asking MDH about these enhanced dispensing fees for just I didn't want it to be just for accessible labels, because there are these compliant packaging and other things that pharmacies are doing that are not getting reimbursed for. They are more expensive, and just wanted to see what the feasibility was.
I'm going to propose that we go with providing accessible labels and compliant packaging for, I'm going to get the right language again, print disabled individuals instead of visually impaired individuals. Because that's reflecting the language in the bill, and it doesn't go beyond the bill. Is there any objection from the members of the subcommittee? Okay, hearing none. Is there a motion on? Oh, okay, I see some more hands. Sorry, Sarah Price.
Thank you, Mr. Chair. I'm here with the Maryland Association of Chain Drug Stores. I just wanted to say that we were also part of this conversation, and we appreciated the opportunity to work things out ahead of subcommittee. We are supportive of the amendment. I did want to say that we would support Aaliyah's suggestion as well, but ultimately we're okay with moving forward with this and the amendments as presented.
With the change that I just discussed.
I don't want to be disrespectful. Is it necessary if the intent is to, if in rejecting Aaliyah's suggestion, if you plan to just continue the study as presented, do you need to change the language?
I guess you don't have to, no.
I wouldn't want the committee to cause more work for itself if you don't have to.
I'm fine with keeping it as is visually impaired.
Okay.
If there is no objection, fine. Ms. Othman.
Hi, good evening. I am the president of the National Federation of the Blind of Maryland, so we're the lead advocacy organization. that's been working on this, and appreciate the subcommittee, appreciate Delegate Hill and of course, Delegate Guyton and all of you. I would say that we would prefer to keep it as a blind bill. But it sounds like, Mr. Chair, you are headed in that direction anyway. I also just want to reiterate to the subcommittee that Delegate Guyton has committed to working with the pharmacy organizations in next year's session to assist with finding methods to offset some of the cost. But I also want to clarify that in the efforts and research, the cost of implementing this is actually not significant, comparatively speaking with other things that pharmacists and others have had to do. So we're just really excited to be able to hopefully safely be able to take our medication, and wanted to thank you all for being willing to work through this with us.
And thank you for hanging in there this evening.
Thank you.
Pleasure. Delegate White.
Yes, thank you, Mr. Chair. I just wanted, in respect to the language at the last line of section 3, where we were discussing around visually impaired individuals, I wonder if it would be possible for us to just simply repeat the language that's at the top that says for blind, visually impaired, and print disabled individuals. That way it repeats the language that is throughout all of these amendments. Is that something that we could consider, or would that resolve some of the questions there? I wonder. I just wanted to pose that to the.
I would be okay with that. This will be the third time we've done this, but that's.
I know. I'm sorry.
Okay.
I'm sorry. Just was trying to put that in there so it was
Yeah, it's
throughout.
consistent.
That's
It
all.
is consistent.
Yeah.
Delegate Morgan.
I was just gonna remind the committee, I mean, it's 9:20. It's getting kind of late for any amendments that start off with striking the bill.
All right. Is there
Just saying.
consensus? Is there consensus on what Delegate White has proposed? I hear no objection. We'll move forward. On the amendment as amended,
Move the amendments.
so moved. Hearing no objection, they are approved. Is there a motion on the bill as amended?
Move the bill as amended.
So moved.
Second.
Second, all those in favor say aye. Anyone opposed, please raise your hand, indicate by some manner. There is no one opposed. It is unanimous. House Bill 717. Boom.
This bill authorizes a licensed certified midwife to delegate a technical task to an assistant, authorizes a licensed certified nurse midwife or licensed certified midwife to personally prepare and dispense a starter dosage of a drug, eliminates the requirement that an applicant for a certified midwife license complete coursework in health and sciences, alters the definition of practice certified midwifery, practice nurse midwifery, certified medication technician, and certified nursing assistant, adds an exception to the licensure requirement to practice certified midwifery, authorizes the Maryland Board of Nursing to appoint peer advisory committees to provide advice related to midwifery, requires the board to develop regulations governing the delegation of technical tasks by licensed certified midwives to assistants, and requires the Department of Health to submit a report on recommendations to expand access to birthing services in birthing centers in the state. I circulated amendment on the bill. These came from the Board of Nursing. They make technical changes, clarify the definition of certified medication technician regarding the tasks performed by a certified medication technician, and the definition of certified nursing assistant to clarify that practice is subject to regulations adopted by the board, and clarifies the education required for an individual to be exempt from requirements to be licensed as a certified midwife.
Is there any discussion on the amendments or on the amendments? Is there a motion to adopt the amendments?
Move the amendments.
So moved. There is no objection here. Is there a motion on the bill as amended?
Move the bill as amended.
So moved. Seconded. All those in favor say aye.
Aye.
Aye. Anyone opposed? Chair seeing none, it is unanimous. House Bill 962.
This bill is generally consolidating and reorganizing provisions related to physicians, physician assistants, and allied health professions regulated by the Maryland Board of Physicians. There are a number of slight changes in the bill. Nothing that is different from last year's bill, which passed 131-0 in the House. Would anyone like me to go through the minor changes that I think minor changes were being made last year?
No, it
No
seems to be
amendments on this.
I'm reading hands.
Move
I
favorable.
shouldn't go there. I shouldn't go there.
Second.
Okay. No object. So this bill is unamended?
No amendments. It's a
No
very long
amendments.
bill. It is exactly the same as last year's bill. It
Okay.
really is just reorganizing their statute.
Motion for favorable?
Move the bill.
So moved. Any objections? It is unanimous. 11:56.
This bill authorizes a therapy management contract to be entered into orally or in writing, including electronic form, and stipulates that if entered into orally, the contract must be reduced to writing by the parties. In accordance with these changes, the bill modifies the definition of therapy management contract by repealing the requirement that a contract be written and replacing the requirement that a contract must be signed by the parties with the requirement that a contract must be agreed upon by the parties. The sponsors offered an amendment that requires a therapy management contract entered into orally to be reduced to writing within 30 days after entering into the contract. That was suggested by MedChi, the only people who came in suggesting amendments on the bill.
And with that amendment, everybody, that's unanimous, all the parties support the bill as amended. Is that correct?
I understand it, and I see Delegate Lewis, the sponsor, is nodding.
Yes.
Very good.
Move the amendments.
Amendments are moved, seconded. There is no objection. Bill as amended is moved and seconded. All those in favor of the bill as amended?
Aye.
There are anyone in the minority? No, that's unanimous. House Bill 1159, dental examiners.
As introduced, the bill altered the requirements that a faculty member of the University of Maryland School of Dentistry trained at a foreign dental school must meet to take an examination offered by the American Board of Dental Examiners, the ADEX. The bill originally repealed the requirements that the faculty member must complete training in a dental specialty recognized by the State Board of Dental Examiners and be board certified in a dental specialty recognized by the board. The amendments offered by the sponsor restore those existing requirements for a dental school faculty member trained at a foreign dental school to meet to take the ADEX, and instead additionally authorize a faculty member trained at a foreign dental school to be qualified by the board to take the ADEX if the applicant is a general dentist who has successfully completed a general dental practice residency or advanced education in a general dentistry program and is board certified by the American Board of General Dentistry.
There are no amendments?
Those were the amendments.
Those were the amendments.
Oh,
And I moved
sorry.
the amendments. Second.
And with those amendments, Madam Sponsor, there is unanimity for all the parties are okay with the bill.
Everybody's good. Thank you, Mr.
You're a
Chair.
credible witness. All those in favor of the amendments?
Aye.
Aye, okay. Bill as amended,
Move the bill as amended.
so moved. All those in favor say aye.
Aye.
There are no objections. It moves forward.
Mm.
Final bill for the evening, 1160, Pathway to Nursing Program.
This bill establishes the Maryland Pathway to Nursing Program in the Department of Health to provide practical and financial support to specified nursing students. The bill also establishes the Maryland Pathway to Nursing Advisory Committee with membership to assist the Secretary of Health in the development and implementation of the program. By December 15th, 2023, and annually thereafter, the Secretary of Health must report to the Governor and General Assembly on the implementation of the program. There are amendments on the bill that require regulations adopted by the Secretary to include a requirement that program participants sign an agreement that they intend to practice in the state for at least 2 years. Excuse me, adds a representative from the Department of Labor to the committee and requires the committee to submit a report on or before December 1st, 2024 on whether licensed practical nursing education programs that meet educational program requirements under Title 8 of the Health Occupations article, that's the nursing title, may be eligible for federal and state funding related to apprenticeship programs.
Any discussion on the amendments?
Lindsay, did you see the amendment about the commission will look at apprenticeship programs?
That's the study, the report, December 1st, 2024, on whether
Oh, okay, so
licensed
it's in the
practical
study.
nursing education programs meet educational program requirements under Title 8 may be eligible for federal and state funding related to apprenticeship programs.
Thank you. Sorry. It was just in different language.
I'm talking quickly. I apologize.
No problem, no
No.
problem.
With that, I move the amendments.
Delegate Riley has a hand raised.
Yeah,
okay.
sorry, thanks.
That's okay.
Did any of the amendments address the large fiscal note? I mean, I like the bill, but was anything
Not
done with that?
specifically, but the requirement that program participants say that they will stay in the state for 2 years
Okay.
is somewhat, it's not making the fiscal note
Right.
any smaller, but it means that
A
that money is
guarantee
spent
that
on
they're
people
staying.
who will actually stay here. Yeah,
Okay,
that
thank
was the
you.
idea.
Appreciate it.
Thank you. Good question. On the amendments. No objection to the amendments. Is there a motion on the bill as amended?
Move the bill as
So
amended.
moved.
Second.
All those in favor of the bill as amended? There is no objection. We are unanimous, and I believe, council, we are done.
Yeah.
Okay,
Record time, probably.
Lindsay, could I ask you to let the chair know we are done? I'm going to take my chief of staff to her car, and then I'll be back. But she knows that. But just so you'll let her know.
I'm
we're
in the
done.
office. I'm in the office, so I'll
Oh,
run down and tell her.
Oh,
Okay,
and you're still there, Lisa. Oh, sorry.
thank you. Okay, thank you all very much.
We
See you
adjourn. Thank
tomorrow.
you, sir. Bye.
It's still tomorrow.
Bye.
It's not yet midnight. It may seem like it. Bye-bye.
Bye.